I thought it involved caring for people, taking the best care of them that I could have.
I thought it involved giving medications, being an advocate for a patient.
I really just wanted to work in a school as a nurse. I thought the hours were easy, and I thought it was an easy job.
The more I've grown into my career, I've realized what those things actually entail.
I had no clue I'd end up where I am at this point in my career.
For me, it's the feeling of walking through the front door, knowing that everybody that's here has that same mission, vision, value, the child first and always.
My name is Quincy McGuire, and I'm a float pool nurse here at Primary Children's, and I've worked here for over 2.5 years. I remember the first time I walked into Primary Children's for my clinicals. It was 6:30 in the morning, and I just felt this electricity as I walked through the front doors. And from that moment, I fell in love with this hospital, and I fell in love with the pediatric population. During my initial orientation to the float pool, I learned how to work on all of the different units here in the hospital. My job is unique because I get to work with lots of different patient populations, also a lot of different people in the hospital. I feel like I have not just one central unit, but I have a whole family here at the hospital on every single unit. In the float pool, we can get advanced skills on some of the different units, and so I've been trained in chemotherapy administration. I've been trained on the ventilators and drips here in the PICU, and I've also learned how to work in the emergency room. So one of the things I love about nursing is the opportunity for learning. The float pool has really afforded me an opportunity to continue my education. I've also decided to go back to school and get my nurse practitioner degree. Part of that will be made possible through the tuition reimbursement that Primary Children's offers.
Nursing is my second career. I started out engineering. Kids are different. Kids need someone to protect them. They come with an innocence. I do a lot of different things in this unit. I wear a lot of different hats. I'm a charge nurse. I'm also one of the coordinators for the ECMO program. So all my days are totally different. Primary Children's is a unique place to work. They give me the tools to provide high-level safe care, and they really stand behind us in that. The education I received here is amazing. I hope the future nurses come out with a good tool set. I hope they have a good, strong work ethic, and I hope they're caring. I hope they take nursing seriously. It's a unique career. It's a noble career.
There's a smile.
My name is Karen Talbot. I'm the Assistant Nurse Manager for the Children's Medical Unit. I became a nurse because of the excitement. I started as a floor nurse 12 years ago, and then I progressed into a charge nurse. And then I found a better path that I thought better suited me, and that was taking care of the staff on our unit and ensuring that the families get well taken care of. I love nursing because of all the interactions that take place between people. You're able to get down and talk with those families in their moments where they need you the most, and they depend on you, they trust you. They want you to be able to care for them the way they would if they could.
You make a difference. Every day you make a difference in somebody's life, and it's not just the patient, it's the family. You make a difference in the family's life.
The opportunity I have to help people, and even though that can be draining at times, it's really a privilege to be able to give my all in helping others.
I truly think that's what nursing is about. Like, what if I was laying in that bed? What would I want people to do for me? And in pediatrics, that's what you get to do with these kids. You get to put yourself in their shoes, but also the family's shoes. If you are looking for a career in pediatrics, Primary Children's Hospital is the place to be.